The best treatments for enlarged prostate, BPH. It starts slowly. You wake up once in the night to urinate, then twice, then 4 times. You start avoiding long trips, calculating where the nearest bathroom is. You stand over the toilet for minutes that feel like hours, straining, waiting, frustrated. For millions of men, this isn't just aging. It's a condition called BPH, or an enlarged prostate. And it quietly robs men of peace, dignity, and freedom every single day. But here's the good news. Modern medicine has caught up. Today, tiny staples and laser beams are restoring what was lost. With minimally invasive options like Urolift and powerful laser therapies like HoLEP or green light, men are regaining control over their bodies and their lives. These aren't just treatments, they're lifelines. In this piece, we'll walk through the best treatments for an enlarged prostate, explore how stapling and laser therapy work, weigh their pros and cons, and talk about what happens when things go wrong, because real men face real challenges. And behind every silent struggle is a solution waiting to be heard. Imagine standing over a toilet for 5 full minutes, straining, waiting, but nothing happens. The urge to urinate is overwhelming, the pressure is painful, and the shame. It's silent and suffocating. For millions of men around the world, this isn't a rare occurrence, it's a nightly battle. The inability to perform a basic bodily function steals more than comfort, it steals dignity. But what if a tiny metal staple could restore that dignity? What if a beam of light could offer relief within minutes? Welcome to the world of modern treatments for an enlarged prostate, where science is bringing hope and healing to a problem that was once suffered in silence. Understanding the pain. What BPH does to a man. Benign prostatic hyperplasia, or BPH, is not simply a urinary condition. It's a silent thief. It creeps in with age and gradually begins to rob men of comfort, quality sleep, emotional well-being, and in many cases, their relationships. This condition occurs when the prostate gland enlarges, pressing against the urethra and making it difficult to urinate. The problem isn't life-threatening, but it can feel like life-stopping. Take the story of Mr. Johnson, a 62-year-old retired high school principal and proud father of 4. For months, he brushed aside the signs: frequent nighttime urination, weak urine stream, and difficulty starting. Until one day, he couldn't urinate at all. The pain was unbearable. His bladder was full, yet no relief came. At the emergency room, a catheter was inserted. Mr. Johnson didn't cry from the physical pain. It was the shame, the vulnerability. He wept quietly, holding his wife's hand, feeling less like the strong man he once was. Unfortunately, stories like his are far too common. According to the American Urological Association, BPH affects about 50% of men aged 51 to 60 and up to 90% of men over 80. Stapling the problem. The Urolift system. Now, imagine opening a heavy curtain to let in light. That's exactly what the Urolift system does, without removing a single part of the prostate. Instead, it uses tiny implants, essentially medical-grade staples, to hold back the obstructing prostate tissue and open the urethra, allowing urine to flow more freely. It's a clever, minimally invasive innovation that has quietly transformed the way BPH is treated. For many men, it offers a renewed sense of control and dignity without going under the knife. Here's how it works. Small implants are inserted via a thin device that passes through the urethra. Once positioned, the implants act like curtain hooks, pulling the inner lobes of the prostate apart to create a channel through which urine can pass unimpeded. There's no cutting, no burning, and no removal of tissue. The entire procedure typically takes under an hour and can be done under local or mild sedation. Most patients return home the same day and resume normal activities within 24 to 48 hours. The advantages are significant, especially for men who are hesitant to undergo more invasive procedures. unlike traditional prostate surgeries that carry the risk of sexual dysfunction or incontinence. Urolift preserves sexual function, including ejaculation. For younger men or those still sexually active, this can be a life-changing benefit. It also avoids the use of ongoing medications, which often have side effects like dizziness, fatigue, and decreased libido. But Urolift isn't for everyone. It is most suitable for men with mild to moderate BPH and prostates of a specific size range. For those with severely enlarged glands or with a median lobe protruding into the bladder, Urolift may not be effective. In those cases, more comprehensive treatments like laser surgery may be required. Additionally, while Urolift provides durable results, it's not always permanent. Studies suggest that around 13 to 20% of men may require retreatment within 5 to 7 years, especially if prostate growth continues. And what happens if the staples break, shift, or dislodge? While the risk is rare, it is a valid concern. If an implant moves or becomes less effective, symptoms can return, ranging from slow stream and urgency to complete urinary retention. In such cases, diagnostic tools like ultrasound or cystoscopy can help evaluate the issue. If necessary, a follow-up procedure, either another Urolift or transition to another treatment like laser therapy or TURP, can be performed. The system is designed with safety in mind, and most complications are minor and correctable. Still, the success rate is promising. A 2022 study published in Urology Times revealed that over 80% of men experience substantial symptom relief for up to 5 years post-Urolift. Many reported dramatic improvements in quality of life, including better sleep, reduced urgency, and renewed confidence in daily life activities, like travel, social engagements, and even intimacy. Case highlight. John, 59, had avoided treatment for years, fearing surgery. After one too many sleepless nights and a painful ER visit involving a catheter, he opted for Urolift. It was over before I realized it, he said. And that night, I slept for 8 hours straight, for the first time in months. Urolift is a beacon of hope for those seeking a less invasive but effective path to relief from BPH. It's not a cure for everyone, but for the right patient, it can mean freedom from medications, fear, and the frustrating ritual of bathroom visits every hour. Laser therapy, light that heals. If the Urolift is like pulling back the curtain, laser therapy is like removing the curtain altogether. This technique involves using high-powered lasers to cut or vaporize the overgrown prostate tissue. Two common types are holmium laser enucleation of the prostate, HOLEP, and green light photoselective vaporization, PVP. These are high-tech, highly effective solutions, especially for men with larger prostates. The benefits of laser therapy are impressive. The procedure is highly precise, resulting in less bleeding and faster recovery than traditional open surgery. Many men experience dramatic improvements in urinary flow and symptom relief, with some returning to work within just a few days, and the results are long-lasting. HOLEP, in particular, has shown success rates of over 90%, with most men not requiring retreatment for a decade or more. However, laser therapy is not without its drawbacks. It requires anesthesia, and some men experience temporary burning during urination as the tissue heals. One common side effect is retrograde ejaculation, where semen flows backward into the bladder instead of out through the urethra during climax. While not harmful, it can impact fertility and satisfaction. Additionally, some patients may still need a catheter for a few days post-surgery, especially if their bladder muscles have weakened over time. The silent struggle, living with a catheter. For some men, the inability to urinate leads to an immediate and often distressing solution, a urinary catheter. This thin, flexible tube is inserted through the urethra into the bladder to drain urine, sometimes for days, weeks, or even longer, While it provides immediate relief, it also brings emotional and physical discomfort. Michael, 67, shared his journey of catheter use. Every movement reminded me that I wasn't normal anymore, he said. Sleeping, walking, even hugging my wife, it all changed. I felt dependent and embarrassed. His words reflect what many men endure silently, a sense of loss, vulnerability, and isolation. Catheter use can increase the risk of urinary tract infections, cause discomfort, and make daily activities difficult. It's not a long-term solution, but rather a bridge to something better. Thankfully, with procedures like Urolift and laser therapy, many men can transition off catheters and regain control of their lives. The earlier the intervention, the better the chances of avoiding prolonged catheter use and the complications that come with it. The path to freedom. Every man deserves the dignity of doing something as simple as emptying his bladder without pain or shame. Whether through a tiny staple, a laser beam, or the hands of a skilled urologist, the path to freedom from BPH is within reach. It begins with awareness. It continues with courage to speak up, seek help, and choose a treatment that fits your needs. You don't have to suffer in silence. BPH is common, treatable, and increasingly manageable thanks to medical innovations. Talk to your doctor. Explore your options. Because relief is not just a possibility, it's a promise waiting to be fulfilled.